Hello, everyone. I am Emily Youree here with Fort Worth Moms, and we have just hopped on a live stream for our first ever panel discussion on a very important topic and a very pertinent topic these days of children's mental health. I am joined by a few old friends and a few new friends, and I am excited to introduce them to you. Um, when I call your name, maybe just give a little wave. First up, not only is she another Fort Worth Moms team member, but she has also been in education for 15 years and has been a school counselor since 2012. Please say hi to Miss Adrianne Gilbreath. Hello, we're so glad that you're here. Next up, we have Dr. Brian Dixon. He is the owner of Mindful. It's a local therapy-based psychiatric practice just here in downtown Fort Worth. Next up, we have Kara Holmes. She is the counseling supervisor at ACH Child and Family Services, an organization that is really near and dear to Fort Worth moms. We've done lots of wonderful things with ACH, and we're so happy she's here tonight too. And last but certainly not least, new to town and a new friend of mine, Dr. Meredith Lavalis. She is a child and adolescent psychiatrist with Cook Children's Health Care System. So yay! And if you see me looking down to the side, yes, I have notes, and yes, I'm going to use them. Like I said, I'm Emily. I'm the CEO and owner of Fort Worth Moms, but for the purposes of this panel discussion, I am a mom of two kids, and children's mental health has become a topic that is very important to me, particularly over the last 12 months. Something that we say at Fort Worth Moms is just like every person has physical health, every person has mental health. And sometimes I think as parents, and maybe what our culture has kind of taught us, is that we really focus a lot on what veggies and fruits we can get into our kiddos' bodies. But sometimes we don't pay like enough consecutive attention to also our children's mental health. So I have a few housekeeping items before we dive into our questions. First of all, I'm going to acknowledge that I know we may have severe weather, and we were joking beforehand that we were going to make some secret signal that there was a tornado warning and we all needed to take cover. So please have grace for us. If there is an instance that severe weather, thunders, we have connectivity issues, we're just still rolling with it and just keeping our fingers crossed that we're good to go. The next thing that I want to state is that we will start off with curated questions, but we are going to take questions from the comment section of this stream. We will kind of do that at the end. We will look for questions that we haven't already covered in the panel discussion. But I also want to say that the panelists are not going to be able to address or answer questions that are like specifically related to your kiddo. They can't give medical advice on kiddos they've never seen or evaluated. And also, if your child or someone in your home is having a current mental health crisis, please call 911 and find assistance there. We are not going to be able to address that in the comment section of a live Facebook video. Okay, and I just want to let all of our panelists know that they can answer any question at any time. Just hop off mute and jump in, and we are going to get started. Okay, so I'm making an assumption, and I know it's true in my own family, so I'm making the assumption. Have you seen an uptick in mental health issues for children these last 12 months? And if so, what is it about the pandemic that is causing this?
So I absolutely have seen an uptick, and it was just kind of what I'd seen in my own patients. But I got the numbers yesterday for Cook, and in January there were 40 attempted suicides, which was an all-time high that were treated. And then in 2020, there were 7 children who died of suicide, or adolescents who died of suicide, which is another all-time high. And that number 7 was more than died of child abuse or than died in car accidents at Cook last year. So we're definitely seeing a higher volume of patients with suicidal thoughts or attempting suicide. But that's not the only thing that we're seeing more of. I feel like I'm seeing more anxiety. I'm seeing several new cases of ADHD, even in older children or adolescents that have been missed. And I think the main thing that's causing it is the lack of structure from school and extracurricular activities. So, with depression, we know that having a schedule and having activities that you're planning to do is really important to keeping mood stable. And we've seen that sleep patterns have changed, especially if kids are in virtual school. They're staying up late or not spending as much time doing school, so napping throughout the day. We've seen that the social interactions are fewer. So the kiddos that I have who have social anxiety have been able to avoid those situations that might encourage them to overcome that anxiety. And then with ADHD, sometimes those kids have had the structure in school and a little more support than they are able to have at home when things are virtual or more self guided. And so we've seen grades falling and kids really struggling that way as well.
Yep, and I would add, so I know it's increasing because I can see the general trends. I read the newspaper every morning when I wake up. For me, kind of boots on the ground, front line, I don't see any difference because we were already understaffed and behind as a mental health sector across the nation. And so, with mental health being kind of underfunded, under operationalized, under recognized, we've been fighting an uphill battle even before the pandemic. And so when we get into a pandemic where there's lots of structure, lack of structure, it only gets worse. And so as a result, it kind of burns everybody out. It burns the kids out. It burns the parents out. It burns the mental health professionals out. And so, yes, I'm seeing an uptick of anxiety and depression everywhere, even though in front of me, it's just no immediately in front of me change.
Brian, I would agree with that, or Dr. Dixon, sorry.
No,
I would agree with
call
that.
me Brian. Call me Brian.
I was looking at our numbers as well, and not necessarily noticing a huge change in the volume itself and the numbers, but looking at our trends and kind of my impression as I talk with staff and I look at the clients that I've seen personally, one thing I've noticed is it's not the number, but the severity is more widespread with the clients that we're seeing. So we're seeing an increase in severity of symptoms as they come to see us, and it's not just the smaller volume of clients; it's a greater volume. And one thing I think about as you step back and you think about this pandemic, it has put a strain on pretty much every aspect of our way of life. And I think all of us here could agree we have felt the stress. We have felt that strain on our own mental health. And it trickles down to every single person. I think it would be safe to say that probably every single person has felt this impact in one way or another. And I think that a lot of those institutions and those services that we take for granted, we think this wouldn't be impacted. This is dependable. Was impacted. Things like being able to go see a doctor, being able to go into a grocery store and access food. These things were either taken away from us or those services were altered. And it hasn't just directly impacted us as parents. These are like Meredith said, these are services that impacted our children, not being able to go to school and be with their friends. And some of these children receive services that are vital at their schools. I have a daughter, my youngest has Down syndrome, and the impact for her at age 5, not getting those therapies and those services that we depend upon. I mean, it's so widespread and impacts all of these different areas that when you step back and you look at it, it's just kind of a no wonder, all of us are feeling it.
We have seen, especially with our virtual students who by now have been at home for about a year, since last school year, um, we have encouraged students to come back to in person, especially if they are having mental health issues. I know that may sound like unsafe but it was we see like almost an immediate change in students when they come back to school. They're in class, they're with their friends. Sitting at home by yourself, if that's not like your kind of MO, can be really lonely. And especially if you don't have parents that are able to be home with you to kind of encourage you, to support you through this virtual learning. Um, and then you kind of go through the like YouTube rabbit hole and they watch stuff that they really shouldn't be watching. Coming back to school, although I was very nervous about being back at school, I have seen like the students who are there are doing really well. And of course, we're doing everything we can to make sure they stay safe, but it has been great for them mentally, for their mental health. So for sure.
Okay, I want to ask, kind of building upon that, certainly within my own household, I can say like yes and amen to everything you say. I've seen this lived out in what we are experiencing at home with our own kiddos. Um, Talking to other moms and just the discussion that's been going on in our Fort Worth mom circles is that we ourselves, our parents, are enduring our own mental health challenges, feeling very worn and weathered at this 12-month mark. But we see kiddos who maybe before the pandemic wouldn't have been put in this box of having mental health issues. We see those kids struggling in various ways. New things have come up that weren't part of their personality or their MO, like Adrianne kind of said. And then we also see our kiddos who might have fit inside of that mental health struggle box. We see them, like you mentioned, Kara, being more severe. So, what are your tips for parents who are at home and we are finding ourselves in this and we're concerned and we're caring about our kids' mental health, but we don't really have a frame of reference or know what to do to help our kids through this or to impact them in ways to help them cope? Like, what are your tips for parents to better support kids' mental health at home?
Communicate. You just have to almost overly communicate. I work with middle school students, so of course their hormones are raging. They can be kind of like little jerks sometimes, to be honest. But continue to talk with them. You have to ask those questions and really try to dig deep and see what really is going on with them. And if you notice any trends that you see, like grade slipping, or you see them maybe hanging out with people that maybe you don't agree with. Those are all things that you guys need to sit down and talk about, like just continuously talk. And if you can also, because they are on the computer so much now, even my in-person students are on the computer all day. If we can like eliminate the screen time, like once they get home, and really like sit down, converse with one another, like go out and walk, go to the park, do something, but don't just sit in front of the TV. That's definitely not going to help. So
I completely agree, to echo Adrianne's sentiment. So it's kind of like sugar. If you eat a lot of sugar at some point, you reach your saturation point, and then it's going to be a crash after that. So when you are putting in YouTube and Minecraft and Roblox and movies and all this dopamine producing things into your body, into your brain, into your kid's brain, you have to come down off that high at some point. And so one of the things that kind of shocked me was talking to one of my dads who brought their kiddo in. And he said, I just turn everything off and we just go outside and play. And my kids have done beautifully since we've done that. And so, yeah, I'm all about green space and everything Adrianne said. Check plus. I agree.
One thing I love talking about with my families is I think a lot of times as parents, we play defensive. We're fielding all of the behaviors and attitudes and constantly responding to that. But taking more of an offensive approach and looking at building resiliency in your child. So thinking about how I can build into my child. I think this pandemic has highlighted for all of us that life is not always even, or even with just ups. We have downs. It's a natural part of life. So helping our children and even reminding ourselves that we should expect this. This is normal. I like to explain it like when you go to a circus and you see the person up on the tightrope, and she's walking. There's a net to catch her underneath, right? And so I like to think in the mental health world of that net, like we call them protective factors. And so when you have strong protective factors and you hit that load, you're going to fall off that tightrope. If you have strong protective factors, maybe you don't fall down so far, or maybe it doesn't injure you when you land on that net. You can get up more quickly. So looking at things like helping your child build healthy social support. So good connections at home, good friendships outside the home. Are there good adults, safe and healthy adults outside of parents that they can trust and build into? Helping them with to learn safe and healthy coping skills. So these are skills that help us manage our emotions and respond to stressful or challenging situations in a healthy way. Like was mentioned, physical health. This is something, our body is so intricate and amazing. And so lack of sleep, a poor diet, lack of exercise, these things all play into how we can handle challenges and stressful situations in our lives. So I would just encourage parents, learn about resiliency, building resiliency in your child. Learn about what are protective factors, what are things I can help my child learn, and even myself, so that when I do face those challenges, we can be more resilient and pull together to come through it.
Absolutely. I think that is a main thing that I talk about my families with, is that kids, before they're able to regulate themselves and their emotions in their body, look to parents or other adults in their lives as models. And so if parents are struggling in this time, because it's something that's been a lot for all of us, I'm encouraging families and parents to get themselves treatment, because then they'll be better able to be that positive role model for their kid at home. It can be really hard for a kid to get better if they're not seeing that positive model in the house. Other things that we've talked about at home is kind of adding back that structure that they may not have because school is out or they're not doing extracurriculars. So having a daily schedule, having set times that school is happening, set locations where school's going on. You all have mentioned exercise, which I think is great. Getting outside and getting sunlight can help to regulate sleep, and also keeping that sleep schedule just like they were going to school. So a certain bedtime, waking up around the same time every day can be helpful.
I would love to hear from some of our viewers right now in the comments. Do you find those responses surprising? Because I'm going to tell you, like, my gut reaction is, like, I know that you're right. Like, I really do. I believe what you said, and I know that you're right. But from a personal experience, this is my kind of default reaction. When I see these big changes in behavior, or I see things that are like, things that make my heart sad that my kids express to me, or I see them struggling like with depression or anxiety, things that have popped up. Like, I want to have kind of like this big, drastic, dramatic response, because I get into like, I'm going to save my child mode, But it is tried and true. It's the consistency of making that connection, sticking with what we do the same way every day, having that time together to be silly outside. Like, those are the best deposits you can make in your kids. But to me, they sometimes don't feel enough. Like I struggle with that. So I would love to hear if y'all want to comment, if anybody else agrees with me or they're like, no, Emily, you're really silly. So just comment away on that one.
So I'll throw something out there to you, and I say
Okay,
that,
great. This is actually Emily's personal therapy session, is
yeah.
what this is now.
Well, and I throw this out to all my parents. And so anytime I meet with parents, there's a portion of the appointment where I always say, parents are terrible therapists for their own kids because you're so close to them and they're so close to you. And so, yes, I love your enthusiasm and you want what's best for your child and you want to help them with coping skills and to see through the forest. And you do that naturally, right? So all parents do because you are wonderful parents. But there are going to be some certain times where you get to that point and you're like, I don't know what else to do. And that's where therapy is so super helpful because oftentimes kids will listen to someone else that's not you, even when the therapist is saying the exact same thing that you said because of the nature of the relationship. And so, yeah, I'm a big fan of therapy. I think everybody should be in therapy. I think literally every person should have a therapist because I just believe in how great it is. But my advice to all my parents is if you start to kind of feel that you're bumping up against that wall, it may be time to just get somebody else involved. And it's not that you have to do therapy forever. It's just some interim therapy, some brief therapy can be really, really helpful.
Look at you segueing into my next question. I mean, fantastic. My next question was like, when my kiddo gets a temperature of 103, I know I need to call the doctor. How do we as parents know when we need to seek support and resources for our kiddos outside of the home in terms of their mental health?
I always say go to their phones first. I'm a middle school person, so middle schoolers are always on their phones. So I say check phones. You will find a lot of things there. So make sure you are aware of what your child is watching on their phone, who they're talking to on their phone. So I just say check phones, like electronics are pretty good places because you'll find that they'll, text messages to friends and they'll tell them things that they won't tell you. And I know it may sound like you're being invasive, but not really. Like you're the parent, it's fine. So, so you'll find that, they tell their friends some things and you'll may be alarmed. You may need some help. But yeah, and there are those warning signs of like depression, suicidal thoughts, like the grades dropping, not being interested in things that they used to be interested in, giving away things that they really value that somehow now they don't care about them anymore. Just becoming kind of reclusive, sleeping a lot, eating a lot, not eating enough. I mean, there's a million things that you could look for, but I think most parents will figure out, like, I know my kid and I know that something's not right. So yeah, any of those things. It could be a plethora of things, but I think your gut will probably tell you most of the time.
And I think there's an intermediate step. So if you're not sure before going straight to therapy or a psychiatrist, you can always ask somebody who's already on your team, like a pediatrician or primary care doctor. They are awesome at being able to identify if something is normal development or if it's something that they can treat themselves or if it's something that they need to escalate to a therapist or psychiatrist.
And I guess I forgot about my own profession. Yes, you can go to your school counselor. So starting at the school is a great place to start to talk with. And we do have, I can at least speak for Fort Worth ISD, we do have a plethora of resources, and we outsource to many places, but we are a great starting point for sure. So if you are having some questions, definitely go to your school counselor. They'll be more than willing to help you.
Okay, super. So, I mean, there are hurdles to getting the kind of support sometimes. Just not knowing where to start is kind of, one of the biggest, but also the cost of mental health care, once you kind of get started on that path, can be roadblocks for some people. And it's kind of a sensitive topic to talk about in the mental health community. So I would love for y'all to jump into that. Like, how can we make in Fort Worth, how can parents find mental health support that's going to fit with their finances?
I'll jump in here. I think there are a lot of different avenues you can explore. One being starting with the school. We work with the schools through a lot of the schools have family resource centers, and we through that are able to provide counseling to families. Talking to the school counselor and getting referrals to agencies like ACH. Lena Pope Home is another one where it's either free or low cost counseling. There are also some other ideas, such as just going through your insurance. I think a lot of people skip that sometimes because you feel like your options are limited, but there are a lot of therapists that do take insurance, and you can check them out, read their websites, and maybe find a good fit for your family. And then there are also other maybe less traditional avenues, like even going to churches. A lot of churches in the area have counseling, and they have sliding scales to work with your budget. So there are different options. It's just a matter of calling around, and I know that can feel overwhelming at times, but hopefully with these direct places you can go to, going to the school counselor, you can call ACH. Our main line is a crisis line, and they don't just plug our programs. They have resources for all over Tarrant County and surrounding counties, and would love to help your family find the resources that you need. So those resources are available to you. It's just a matter of knowing who to go to and then asking those questions.
Yeah, and keeping in mind, so Fort Worth is at a very interesting crux when it comes to mental health, because we have lots of different resources, as Kara mentioned, and just a lot of different modalities, lots of different ways of doing therapy and doing mental health work. I've had the pleasure of working over at Cook Children's. I've worked at MHMR. I'm in private practice now. I do some contract work for correctional facilities. So it feels like I've been around the block. And one thing that I consistently hear is people's frustration with insurance. And I can that'll be a whole other separate podcast that we do sometime. But the key is to ask. Anytime you're talking to someone, ask, what their philosophy is. Ask what they believe, because there are certain folks who are very directive in what they do, and they sit down and they say, okay, here's your plan. Other folks are more expressive or more solution focused or trauma based. And so just asking the broad questions and letting the mental health professional walk you through that is super, super helpful. And then last but not least, keep in mind that when it comes to insurances, especially for psychiatrists, because I hear that a lot, there's no psychiatrist on the panel. One of the hiccups is that if you try to do therapy as a psychiatrist, the insurance doesn't pay for it. Like, no insurance pays for it. And so as a result, it tends to force us to either shorten our therapy and put it into this teeny tiny box, or we have to use medicines. And so that can sometimes create a conflict, to put it bluntly. And so just being very mindful of the financial side. It's not easy. We're working to try to build a better system, of course, but just asking the question is the most important step.
That was super helpful. I'll mention it again at the end, but I'm going to put a plug in here that we're going to download this panel discussion, and we're going to place it on our YouTube. We are also going to publish an article about it, I think the first week of April. And within the content of that article, we will provide hyperlinks to a lot of these resources, also the organizations and practices that these panelists are a part of. And so we hope that we can kind of compile, we're going to take a little time to do it right, compile a document that can be kind of a source for y'all to look for maybe the direction or the path you kind of want to go down and try. Okay, we have 2 questions left that we're going to ask. If you have any questions out there for our viewers, go ahead and put those in comments. I mean, no pressure to ask a question, but if you have one you want to, we are going to try to take a few minutes to answer those. Here we're going to go with the last 2. All right. What encouragement or clarification would you give to a mom who is maybe leery about support services like counseling or medicines?
So that's something that I see often. And so I would encourage families that if you're considering that your child may need therapy or medication, making the appointment and then talking with the professional about your concerns. So if there are certain things about medicine that you're concerned about, because the provider will be able to give you accurate information. I think with mental health, there's still stigma surrounding our treatment and medications, and sometimes that's reflected in the information that you can find online. And so being able to hear, the true percentages of side effects and things like that from someone with the knowledge is important.
I always tell parents, if your child was physically ill, you would have no problem at all going to the doctor and getting the help that they need. And this is literally the same. It is the same concern. It's the same. It's as important, sometimes more important than their physical health. So if you just look at it as it's an illness or just something they need help with, it's the same thing. So if medication is what they need, of course, like Ms. Meredith said, talk to the professionals, figure that thing out. I know I do have a lot of parents who are leery of medication, but like she said, find out the facts from the professionals. In therapy, I'm like, it's just like talking to your best friend. So just go and give it a go. There's really nothing you can lose, so just give it a try. But it's just like going to the regular doctor. And if your child needed medical attention, you would certainly go. And this is the exact same thing.
I'm gonna talk about it more from the counseling side, since I don't prescribe medicine. I'll leave that to the people who do that. But I do think there is a stigma surrounding the mental health field. I think it's probably a lot of that's tied to the fact that we deal with very vulnerable places, very vulnerable feelings, and a lot of times it's really hard to open up and to expose those and to talk about those things. I think that stigma makes us feel like we're weak or shameful, needing help. I should be able to handle this on my own. And so there's something wrong with me. And I think it is our job together, not us as professionals, but all of us as adults and parents, to help change that conversation and to help our children see it's not that you're weak, it's that you're human. We are all designed needing community and relationship. And sometimes we need help that goes beyond mom or dad. And we need that professional to come in and maybe just give us an unbiased outside opinion to say, hey, you are not at fault for that, or this is totally normal. And to hear that from someone else, it can be freeing for our children. So just reminding them, we're all human. We're all going to need it at times. I totally agree with Brian. Like, I think everyone should have a therapist. Try counseling out every now and then. And you'll find you're going to be better for it, even if it's just a short-term visit. So.
And I would throw in there, and I'm going to speak for Dr. Lavalis. Hopefully she won't mind, which is if we could help your child feel better and not use medication, that is our first goal. So if we can use therapy, if we can support you in whatever way we need to support you, and not using medicine, absolutely. That's our first goal because, yeah, we don't want to expose your little one to anything that they don't need to be exposed to, right? So that's number one. And then number two, if we do start a medication, because we've been through lots and lots of training, so if we do recommend something, you always have the right to stop it. The other idea is that it's a bridge. So our goal is to get you and your child from one place to another, and at some point try to get them off of that medication. And so if possible, and we want to do that very safely. The key is communication. And so we both want to stay in contact with you. We want to hear questions, concerns, side effects, worries. What did you read on Dr. Google, right? So that we can walk in this with y'all as a partnership. This isn't paternalism medicine anymore. It's not, hey, you go do this and just follow my rules. It doesn't work that way anymore. We're not trained that way anymore. And so, yeah, it truly is a partnership, and we're in it for the long haul because working with kids is such a blessing and such an honor, and we take that very seriously. So.
Okay, that is excellent. That was excellent encouragement. I was kind of moved just listening to y'all talk about that. Okay, last question. You get to be even more inspirational here with your last shot. No pressure. But what is one piece of advice or one bit of encouragement that you would give to a mom right now who's watching this, whether she's watching it live or she's going to end up watching it sometime tomorrow or the next week? What would you say to that mom who is currently parenting a kiddo with mental health struggles?
I would say do not underestimate the power of the parent-child relationship. There is so much research showing the incredible benefits of safe and healthy attachment. And as a mom or a caregiver, whatever your role is with that child, there is so much healing power in nurturing that attachment with your child. A lot of times I think we feel helpless because our kids may rebuff our efforts, or we get in these negative cycles where it's easy to get caught up just saying no and just correcting. And there are really simple ways we can step in and bring healing, even if our kids aren't in it with us. Things like just looking for ways to positively affirm your child. For every negative, for every correction, think, I want to try and get 5 or 6 positive affirmations. Look for ways that your child does something well and praise them for it. Let them know, hey, I saw you made your bed this morning. Thank you so much. And look for those ways to build them up. Look for ways to spend quantity and quality time together. Just be present. Put down the phones. Don't feel like you have to force conversations. Just be with them and allow that to naturally happen as that relationship develops. And just remember, you as the mom, since we're Fort Worth moms, but any caregiver, you have that really important opportunity to build into your child.
I always say for any parent who's parenting, period, mental health or not, find your tribe. Parents, you need support too. So if you are parenting a child who may have mental health issues, having another friend or another mom or another parent who may be walking this same journey with you is like invaluable. So find that support system for you as well as your child. So just make sure that you're taking care of yourself as well, and you'll be able to much better take care of your child.
Yeah, I would throw out, so some really awesome therapists taught me never rob your patients of their competence. So, I think it was during supervision when I was in residency, and I've always taken that to heart. And anytime that I'm working with my families in my office, I encourage my moms and dads and caregivers to do the same. Kids are amazing. They're these amazing little learning machines. They know exactly what buttons to push. They know exactly what to say or do to make something happen on their behalf. And so sometimes you can actually get away with doing less. I love what Kara said, just be present, right? You don't have to problem solve. You don't have to jump in and save, just be present. I'm listening. How can I help you? and then they will figure it out for themselves. And so, yeah, so take some time for yourself. There is time for that. And at the end of the day, making mud pies in the backyard is a great learning experience. So yeah, I'd say just be present, and yeah, don't rob your kiddos of their competence, because they are incredibly smart.
So I think just echoing what everyone else has said, we are certainly in unprecedented times, the phrase everyone's repeating. And so we're all navigating this as a new situation. And so taking it one step at a time, Cook is starting a program next month, a suicide prevention campaign. And so there'll be a series of stories there that will go further into dealing with mental health issues in this time. And so that could be one potential resource.
Well, thank you so much. We haven't had any questions pop up. If you have one, now is your second to do it. But I do want to say, like, from all of my heart, thank you to the four of you for participating in this panel. You got a random email from Emily at Fort Worth Moms one day, and I want everyone to know that they are volunteering their time on 8 o'clock on a weeknight after they have worked long days, and they are frontline workers in this mental health crisis that we are currently living through. And so it means the world to us that you would take this time from your free time and invest it in the moms and the parents in this local community. So thank you, thank you, thank you. As I mentioned earlier, I will probably even come back in the comments and give links like to ACH and to Mindful, to Cook Children's in the comments, so y'all can see those right away. We are going to be publishing an article that is a more exhaustive kind of compilation of resources that are available in Tarrant County, as well as including this video in that too. So we care really deeply about the issue at Fort Worth Moms, because we're living it right now. And this is not just a one-off emphasis on this topic for us. It's something that we're really committed to in 2021. And thank you for joining me in that. So thank you all so much. I appreciated it, and good night.